some of you are crying. First, because when he first mentioned this, I'm like, really? Now? And this was a while ago. But what timing? Just think about it. You just turn on the TV and it's here. You know, when he first mentioned it, who would have thought that there would be over 90,000 confirmed cases worldwide? Who would have thought that this infection was in 70 countries and territories? And now in the United States, we have over 100 cases. I know we've heard of a couple people that got tested in New Jersey, but as of this moment, because it can change, we don't have any. How many had the flu this year? I thought that was a terrifying experience. I had had the flu before, I had gotten a shot, but I'm like, if this is worse than the flu, or if this could look like the flu, how do you know if you have the flu now? So I'm excited that we have a panel of experts that are going to share their expertise with us. I only learned yesterday that I've been washing my hands wrong. I thought I was doing a good job. Then I watched on TV, I didn't wash between my fingers, which I thought if you did a whole, the whole hand, front and back and around, that was enough. So I'm learning. And I also learned a little tidbit that you should wash your hands for 20 seconds. No one really knows how long 20 seconds really is, unless you time it. But they've said, and it's in the bathroom, I've read it again, you sing happy birthday twice. And if you're from London, God Save the Queen, and if you're from Ecuador, they have their own song. So some people have now brought some humor into this. I'm going to put my hat on, my former hat as Assembly Chair of Homeland Security. Some of you were actually here when I had the Are You Ready programs. It's always good to have extra water in your house in case you need it, and extra food. What's the worst can happen? You have a little extra of what you may need if there's an emergency. So I am delighted to co-host this event along with the Senator and the freeholders, and I am here with you to learn too. So thank you very much.
Thank you. I'm thinking about having Annette demonstrate the happy birthday song twice. We can make a little light of it, but it is important. Isn't it amazing that we've all learned so much in just the past few days about preventive care and things we can do? And I just have a couple other quick thank yous, and then we'll begin our program. I want to thank members of the town committee here in Union that joined us today, our Deputy Mayor Jim Florio, our committee folks Suzette Gavadas and Danny Figueroa. Thank you for joining us. And I do remiss, in a few minutes, she's not going to get introduced right now. You'll see a young lady jump up on the panel. That will be Annie McNair, who's our county health officer. I want to take one more opportunity to thank our freeholder board for their partnership, in particular Chairman Marabella, as with the lovely ladies over here for your blood pressure, your Purell, your tissues, and all the information you need. So with that, let me go ahead and begin our program and introduce our panel of speakers. I am so honored to introduce to you, to my immediate left, the fellow with the tie on, suit and tie, no doctor jacket. He is Dr. Jason Kessler. He is the Chief of Infectious Disease at Morristown Medical Center, part of the Atlantic Health System. Please welcome Dr. Kessler. Dr. Sanyel, next to him, you want to figure out which one is in the middle there with the jacket on? Right, Doc, give him a wave, right? Dr. Sanyel is a third-year medical resident. He's from Trinitas Regional, and I also want to thank the folks from Trinitas for being here today. Mary, let's thank you very much. We appreciate it. Let's give Dr. a round of applause as well. And from the Township of Union, our health officer, Marconi Gappas. Marconi, thank you for being with us today. So with that, I'm going to turn it over. Each of the panelists is going to speak first, and then we're going to have a Q&A session. That literally is the format for tonight. So if you have questions in your head, make sure you keep them. If you need a sheet of paper or something, just wave us down. We do have some pens and paper. And we're going to begin with Dr. Kessler. Doctor, thank you. Please, by all means.
Hello. I had some slides, or a few slides. I don't know if we have them up. Okay, great. So I think we were tasked with trying to address concerns and to try to provide further information about some of the health issues that have been in the news recently and things that have been affecting our communities over the past several years. And because they sort of overlap in many different ways, I think we're going to try to address them together in one form. I think a lot of the questions and issues and concerns probably that are on many of your minds, and certainly on the minds of the members of the community that I live in, both folks who have no healthcare background as well as those who do, is the issues surrounding the novel coronavirus, and we're certainly going to delve into that. But I think a lot of the messages that I have for folks in my community, in my hospital, and even in my own household, are simple messages, preventive messages that help protect my family, my patients, and my community from infection with many different germs, pathogens, viruses that can cause them to be unwell. And that would be appropriate both for novel coronavirus, as well as the prevention of influenza, as well as the prevention of other similar types of respiratory infections. I put up here to start with really, I thought, a very nice picture or a pictograph that was developed by my professional society, the Infectious Disease Society of America. I think it takes you through the main questions and concerns that most people have about what's going on currently, both in this country and around the world. I think the first question that people have is, what is this novel coronavirus? Where did it come from? How come it's causing a problem right now? The coronaviruses are a family of viruses that exist primarily in animals, but also can cause infection in humans. And many people, probably in this room, have been infected with a coronavirus at one time or another. There are several species of coronavirus that commonly cause respiratory infections and colds in normal, healthy adults or normal, healthy children. These viruses circulate in the adult population in the community on an annual basis. And you may not even know that you ever had one of these infections unless you went to the hospital or went to your doctor's office and had a specialized test performed. You may not even be aware that you ever were infected with a coronavirus. So there are very routine viruses that we classify as coronavirus that can cause fairly benign infections like the common cold in adults. Different than the typical coronaviruses that are associated with human illnesses. Many of you may remember some of the previous issues and outbreaks that have occurred over the last several years, like SARS, which occurred in 2003, 2004, and more recently MERS, the Middle East Respiratory Syndrome virus, which occurred in, started between 2012 and 2013, and is ongoing even today. These are other types of coronaviruses, and this new novel coronavirus, which is now called COVID-19, is in that family of viruses. And these subset of coronaviruses can cause more severe human illness or sickness than the sort of typical coronaviruses that can cause the common cold that sort of circulate in the population on a sort of annual basis. And so this infection, like I said, first became known at the end of last year and was first detected by Chinese health officials. And this became identified. It was isolated by the Chinese health services in late 2019 into early 2020. And it began to be tracked more closely and surveilled more closely in and around that time. So what exactly makes this virus somewhat different than the other coronaviruses is not 100% clear. There's a lot that we don't yet know about this coronavirus and how it compares to things like SARS and MERS and the other viruses that can cause human infection. But what we do know is that it certainly does have the capacity to cause severe illness. But we also know that, and what we're learning is that the vast majority of people who have been infected with this virus actually have very mild symptoms and very mild illness, and sometimes even may have asymptomatic, meaning they're not even sick at all. They may have just been infected and they don't even really know that they have it. There is a small proportion of people, probably in the neighborhood of somewhere between 10 and 20% of people who have more significant illness. They may have a sickness or an illness that causes them to present to the hospital or to their doctor. They have an illness that may require hospitalization. They have an illness that may require specialized therapy to get better. But again, they represent a small sub-segment of the overall population that is infected with this virus. So I'm sure there'll be other questions, but I'm going to kind of move on to the second point that I wanted to address. The second issue I wanted to address is probably the most critical issue, which is what can we do about this virus? How can we prevent this virus from infecting us? Because as we know, and as you've all heard in the news, the virus has expanded out from China to other countries in Eastern Asia and now to countries around the world. Like the Assemblywoman has said, more than 70 countries around the world have now reported cases. And there are now more than 100 reported cases in the United States. Fortunately, we haven't had yet any documented cases in New Jersey, but I think it would be more than likely that when this is all said and done, that we will be seeing some cases in our communities sometime in the future. So what can we do to help prevent the spread of this virus and help us prevent us and our loved ones from getting sick? So, like any virus, a virus is a germ, so to speak, that has nucleic acids, DNA, RNA, just like we do, that will allow it to form new copies of itself when it gets inside of its host. For the coronavirus, the novel coronavirus, the host is both an animal vector, which we haven't yet identified, and now humans as well. And so when this virus comes into contact with the cells or the surface of our airway, our mouth and our lungs and our upper airway, it can set up an infection and start reproducing itself in the cells of our airway, of our lungs, of our upper airway and lower airway. And that ongoing reproduction of this virus can do two things. One, it can engender inflammation. Inflammation is our natural response to infection, but inflammation that is out of control at times can cause us to become ill, can cause things like pneumonia, can cause things like having symptoms of shortness of breath, and so on. And secondly, what that does is it allows the virus to replicate and allow itself to spread to other people. So when we cough or sneeze, these viral particles get released in small microscopic droplets that are not visible generally to the human eye, and can spread to surfaces and can spread to other people that we may be in very close contact with. So it's very unlikely that, for instance, if one of us had the novel coronavirus and we were coughing, we would be spreading it, to somebody across the hall. But it's more than likely that we could potentially spread it to our spouse who's living in the same household with us, to our children if they're living in the same household with us. If I'm a doctor taking care of another patient and I have it and I'm coughing and not protecting myself when I'm examining that patient. So that's how the virus can be transmitted. And usually, like I said, it needs to attach to the cells of our upper and lower airway. And so how does it do that? Either we breathe in the particles that I'm describing, or we touch a surface that has the particles and bring them to our face. And it's really that describes the preventive measures that we should be taking. So the things that I'm going to be talking about are things that you've probably already heard on the news or on other programming or read about in the newspaper. So the things of critical importance are excellent, what I call respiratory hygiene, which really means covering your cough. So if you have a cough, or somebody else has a cough, you want to make sure that you're not just coughing into the air, but either use a tissue, use your elbow, or if you have a mask and you feel comfortable wearing a mask, use a mask to prevent the aerosols from being generated from your mouth and from your airway. But really covering up, making sure that you're not coughing on other people is one of the first things to be aware of. The second thing to be aware of is avoiding contact with people who are otherwise sick. And if you are sick, to try and minimize your contact with other healthy people. So, you know, this may not be easily applicable to everybody, but if you're sick and not feeling well, the advice is really to stay home, not go to work, not go out to a large gathering, not go to church, not go to synagogue, whatever the case may be. You know, take care of yourself, make sure you're well before going out. And then finally, the other main thing that we can be doing, which I think people have already highlighted, is excellent hand hygiene. So like I said, these particles, how they get transmitted to our upper airways, to our mouth, to our nose, to our lungs, is that generally speaking, either we're breathing them in or we're touching something and we're touching our faces, which is a very common thing we do. Everyone does it, and most of the time we're not even aware that we're doing it. So we need to make sure that we're washing our hands regularly, even if we haven't yet come into contact with someone we know that is sick. It's always a good idea if you're out and about in the community, around other people, to make sure that you're washing your hands regularly and yourself, keeping your hands clean, especially if you come into contact with someone you believe is sick or may be sick. I guess the third issue, which is sort of a corollary to that, is what do we do if we are sick, or if we have concerns about being sick? I think this, unlike many other diseases or infections, we want to take an extra degree of caution. So if people have concerns about their own health, the first call they should make is to their primary doctor, whether that be their internist, their general practitioner, their pediatrician in the case of a child. Sometimes people have other doctors that they trust and use as their main healthcare providers. So for instance, some women tend to use their obstetrician gynecologist as their primary care provider, but really your first call should be to your primary care provider to discuss the situation with them, to give them the relevant information so they can feed back to you what are the appropriate steps to take as far as diagnosis, as far as treating yourself, and what to do to keep others around you safe. There may be, I'm going to sort of skip over because I'm sure there'll be some questions. I want to let my colleagues say a few words as well. We can talk about, when it would be appropriate to present to a healthcare facility or an office of a healthcare worker, and what steps you should take to do so safely. But I'm going to touch on that sort of after everyone else has a chance to say a few words. So I just want to highlight this in reference to that. So if anyone has any questions, we're here today to answer questions, but I am sure there'll be other questions that arise in the coming days as this situation changes, because I think what we've seen just in the last 4 weeks is that this is a very dynamic situation. What we're telling people today may change because the situation is changing very rapidly. And so questions that come up later today, tomorrow, into next week, into next month, New Jersey Department of Health has been very proactive in setting up a 24-hour public hotline to answer the public's questions and concerns. And I encourage anybody who has questions or concerns about their own health, about the health of a loved one, or health of a community member, to use that hotline. That's what it's there for, to help answer any additional questions or concerns that arise. Again, I just took it right off their front page of their website. The phone number is highlighted in red, 1-800-222-1222. Again, this is staffed 24 hours a day. It's there to serve the public, and it's there to answer some questions specifically about novel coronavirus infection. With that, I'm going to turn it
I'm
over.
actually going to ask for a favor. I had some requests that our next speakers would stand.
Oh,
So I apologize, because you know, everybody did a look at you. So, and by the way, you're more than welcome to come here. Use the platform. Sorry, so, no, that's my error. So you could continue to stand and join us if that's all right. Whatever you're comfortable with.
All right, I'm Dr. Samuel, Dr. Medical Resident Trinitas. Much of what I'm going to say has already been stated, so I'm just going to run through some of the information again. So the coronavirus, as Dr. Kessler mentioned, is a family of viruses that many of us may have been exposed to in the past. It's a respiratory illness, much like the flu and the cold. And this particular virus is new, that's why it's the novel coronavirus, and which is why we are not sure how everyone is going to react to it, because we don't have a previous record of human immunity to this virus. So, as Dr. Kessler mentioned, previous coronaviruses, SARS and MERS, so this is in the same family. So right now the CDC says that, advises that members of the U.S. generally are not at high risk, although there are pockets of cases in the U.S. By and large, most of us are not at risk for contracting the virus. The U.S. Borders and Protection Agency, CDC, are enhancing screening at airports to prevent the virus, but you know, from all the media coverage that it's been getting, it's not to the level that everyone thinks. So some terms, some esoteric terms that healthcare workers might use include isolation and quarantine. So when perhaps passengers coming from affected countries such as China isolate the individuals who may have been exposed, that means they separate them from others. Quarantine means those patients who are or travelers who are not yet sick but may have been exposed to someone who is sick. Those are people that we want to monitor over the course of the incubation period to see if they develop any symptoms. So some of the ways that we monitor are active versus passive monitoring. Active monitoring is where those individuals are in constant correspondence with the New Jersey Health Department or any health department, state health department, to discuss whether they're developing any certain symptoms, or passive monitoring, which involves checking whether or not you come down with an illness after traveling to an affected country, checking your temperature twice a day, and then seeking appropriate care. Although we've been talking more about the coronavirus, and that's what's been the topic of conversation, the influenza is still the leading respiratory infection right now. And as we've seen from previous years, it's affected up to 45 million people nationally. And but just as the flu virus is very unpredictable and it can affect anyone, we have to take appropriate precautions. But generally, the flu doesn't cause as much hysteria and concern as the coronavirus is, even though it's just as lethal, if not more. unpredictable. So we stress as healthcare professionals, all stress that you get vaccinated. It's still not too late to get vaccinated because as we work in the hospitals, we know that there are several cases of the flu virus and it's still very active. So common symptoms of the coronavirus, much like the flu, include, as Dr. Kessler mentioned, fever, cough, shortness of breath. And the mortality that's been reported has been in patients who are already immunocompromised, meaning they have other coexisting illnesses or they're elderly. So as far as treatment, right now several research organizations and World Health Organization are trying to develop different vaccines and antiviral treatments, but right now there's nothing approved. So treatment is basically to treat the symptoms and and if they develop more severe complications such as pneumonia, then treatment in hospital is appropriate. So again, to reinforce the spread of coronavirus through respiratory droplets, coughing and sneezing. So as Dr. Kessler mentioned, we need to emphasize hand hygiene and not touching our face, not touching common surfaces, cleaning items that many people use with disinfectants, tables, and etc. And healthcare workers are the ones who need to wear the protective masks to prevent them from getting exposed from patients. But the common public, it's not really advised that they wear masks unless they're sick, because now with so many people purchasing masks, there's been a shortage of masks that the healthcare workers need to protect themselves and protect the public. So the incubation period is the time in between when the person comes into contact with someone with the virus and then starts to develop symptoms. So from the cases that we've seen, that healthcare workers have seen so far, it can be anywhere from 2 to 14 days. Now there have been some rumors that people who are asymptomatic or have relatively few symptoms can spread the virus, and that's why many people are scared that people who seemingly look like anyone around you, that they could spread the virus. But by and large, the most common form of spreading the virus are those people who have symptoms. Those are usually the people who will spread the virus. So there's obviously a lot of unknowns. The CDC is still trying to acquire information through all the cases that are coming in to find a pattern, and as the information presents itself, though, that information is being relayed to the state health departments. So yes, prevention is key. Dr. Kessler mentioned at length, staying home when you're sick, avoiding other people, and using hand sanitation and protecting yourself, and covering your mouth when you sneeze and cough with a sleeve or a tissue, and disposing of that tissue, not coughing into your hands. So as I mentioned before, the CDC does not currently recommend that the general public wear masks unless you're sick and you want to protect your secretions from affecting other people. So some of the different masks that healthcare professionals use include the N95 mask, which is a mask that completely seals to your face and you have to get fitted, that prevents respiratory droplets from getting into your face. The surgical mask is the one that healthcare workers use the most. It's usually just used for one day and to protect people from their respiratory secretions from affecting others. But again, the CDC does not recommend that that citizens use the masks. So there are several travel guidelines that the CDC publishes for countries that are affected. So if you are planning to travel, we emphasize that you go to the CDC and check the guidelines. And if you do travel to a country that is on the watch list, so to speak, you want to avoid contact with sick people, avoid animals, and wash your hands often. So for those individuals who have recently traveled to an affected area, they need to seek medical care right away. We advise that they call the hospital or primary care doctor beforehand so that they can take the appropriate precautions so that other people aren't affected. And these things we've already mentioned. So the CDC has been compiling data regarding the new cases and monitoring the situation and communicating with the state health departments, and as I mentioned, improving the screening and making sure that all passengers coming in at airports from affected areas are appropriately quarantined. And so for travelers coming in from China to the US, they get a card from the CDC which details exactly what they should be watching out for over the courses of 14 days in which they might develop symptoms. So if that traveler develops a fever or has difficulty breathing, they would want to seek care with their primary care doctor. So the people who should be tested are not just anybody. The specific people that should be tested are those who have recently traveled to an affected area, those who have come into contact with someone who contracted the virus, or healthcare workers who have been exposed to specific individuals with confirmed coronavirus. But otherwise, there's no indication to just check it in the general public. So the NJ Department of Health, which organized this presentation, is working closely with the CDC, making sure that all knowledge is disseminated to the state and all the infection control departments so that everyone is aware of what's happening. And if you want to get reliable information, in addition to the CDC, you can visit the NJ Department of Health, and that's the website there. You can just Google NJ Department of Health or CDC, and so you can get real information, not just information that all your friends are posting on social media, etc. And there's a national hotline again for patients or people who are concerned about the coronavirus. Yeah.
Thank you, Doctor. By the way, if we have your email and you want, we will send you these slides. All right, so you don't have to log the numbers and those sort of things. We've certainly filled up. So I got to say this to both our doctors. Please give them another round of applause. And to Marconi Gapis, who gets to go third, come on up. And thank you very much. We won't be joined by our county health officer tonight, but Marconi will close out our program, and then we'll move to question and answer.
Thank you, Senator. Thank you, Mayor, Township Committee. Good evening, everyone. My name is Marconi Gravis, and my particular piece for this evening is to share with you in terms of potentially contracting COVID-19. Again, this is a very rapidly evolving situation. One of the things that we're responsible for is monitoring of individuals that were traveling from Wuhan City, from Hubei Province, and also from mainland China. What essentially happens is the CDC has a global migration and quarantine division, which screens individuals, asks questions about their travel itineraries, whether they were in mainland China, whether they were in Wuhan City or Hubei province, or whether they were in transit back and forth within their itinerary. What ends up happening is when there is those that deserve high attention, the ones from Wuhan and Hubei province, they were immediately quarantined by federal authorities. We do have a quarantine facility here in New Jersey. In the event that we had to, again, right now I believe there was in the afternoon there was one individual that was in transit early on in this development, and they were subsequently released. They were a resident from out of state. So again, this was one individual that happened to come from one of the high-risk areas, but was eventually cleared. Most of the monitoring that we do, that we have been doing over the past several weeks, were individuals that were at moderate, considered moderate, or medium risk. These were people that were traveling through mainland China. There was no quarantine necessary. There was no active monitoring necessary where we had to check in with them daily. There was some passive where they would have to monitor their temperatures and report any illnesses, but there wasn't anything that mandated any sort of direct control by the local health department. So again, we are in constant contact. A rapidly evolving situation. I wouldn't put it on a PowerPoint because I constantly get updates. And if you go to the CDC website, just got notification today on the counts. And if you're going to be looking for information, please use the State Department of Health website and those CDC links. They will have the most current information. They just announced this afternoon that they will be updating their situational counts and stats for the U.S. Monday through Friday by noontime. They continue to collect data until about 4 o'clock. So if you want the most recent information, Monday through Friday around noon, that's what it'll be updated. So some of the things that we recently found out, the State Department of Health did get authorization to do confirmatory testing here in New Jersey just yesterday, and they are rolling out a vast number of kits. I mean, our healthcare providers are already submitting the nasopharyngeal swabs, and but we used to, prior to our authorization, we would have to send it down to Atlanta. That no longer has to take place. We can do it at our public health lab now, and there's an 8-hour turnaround from what I was told. That's going to be, we're looking, and we are going to thank you. And we're going to keep an eye out, and yes, when you look, it's highly likely that that we're going to come across a confirmed case. But again, we do have the infrastructure in place in terms of our area. We work with, Andy McNair wasn't able to make it tonight, but we work with the county links office. That's a communication hub that gives us information from the state. We exercise with them regularly in terms of, like for Sandy, we had to go out and get supplies in the event that we need to have a response, hopefully not. We have medical countermeasures plans in place, point of distribution plans in place. In the event, right now there is no vaccine for it, but in the event that we do have to get some medication out, we have done this before. We had a massive response in this area and a very great, robust response to H1N1 back in 2010. We're here in just in this community, we vaccinated over 6,600 people and ran 47 clinics in a matter of, I'd say, about 2.5 to 3 months. So we have the experience here. We are ready to respond, and we are working very closely with our public health government partners and also our healthcare practitioners. So I guess I'll just leave the rest for Q&A.
Thank you. Let's hear it for all our speakers. Just a tremendous job. So our speakers have been kind enough to open it up for questions. And I see that the Assemblywoman over here on the right has a question. Please.
Can you estimate how long the droplets from the coronavirus live on the surface that you can touch the rock? And then the follow-up is cleaning with Clorox wipes, does that help?
So I think that the answer to your question is we don't know for sure. I think that there are estimates that the viral particles could live on surfaces anywhere from hours to days. So it does make sense for high-touch surfaces where many people may be accessing those surfaces, that they be cleaned regularly. Clorox wipes, bleach wipes are a good mechanism by which, but even soap and water is a reasonable alternative. So, because that can mechanically clean. Soap and water doesn't necessarily kill the viruses, but it will mechanically remove them from the surface. So if you have access to bleach wipes, that's fantastic. If you just have soap and water, that's also very reasonable.
Anybody? While we're getting someone else for a question, I saw Debbie Sue Anderson back there, our County Health and Human Services. Thank you, Debbie, for joining us today and your support. And I thought I saw Community Clifton people from there. Thank you back there. I'm happy that we have enough people that it's hard to see you. So we have another question.
First, I wanted to thank you for coming out here today. One of the things, before I go to my question, I do have several questions. I'm going to explain to you why. One is I'm the unfortunate person who caught the swine flu. There was I traveled overseas with my entire family. There was like 8 of us, and out of all 8, I was the one person that caught the swine flu. And I'm also the person who gets the flu, even though I have the flu shot. So you can understand a little bit of my concern. The other thing is my son's actually has a health class right now in 6th grade, and one of his topics that he's doing research on is coronavirus. So every day he comes home and tells me something new. So I apologize for all my questions in advance. One of the things is, I know you gentlemen spoke about the different symptoms of the coronavirus, but is there anything in particular that stands out so that you know for sure that there is a likelihood that you do have the coronavirus versus a common cold or the flu? Because you do get a fever with the flu, some of those symptoms are a little similar. So is there any one particular symptom that does stand out?
I think that the spectrum, meaning how a patient presents with novel coronavirus, is indistinguishable from how they may present with other respiratory illnesses like influenza, like common cold, like other viral infections. So there really isn't any way to know yourself, based on your symptoms, based on your fever, based on other parameters, whether or not you have a coronavirus infection, or whether or not you have influenza, or whether or not you have something else. I think what's important for the public to be aware of is the warning signs and symptoms of knowing when something's wrong, knowing when you need help, knowing when you need to seek attention, beyond just staying home. You have a mild cold, we all just kind of, okay, we're not feeling well today, we have a little bit of a cough, we stay home, goes away in a day or two, and we kind of go on our way. It's not like we're running out to go to the doctor every time we get a common cold. So I think, like I said, there is no way to distinguish this disease clinically from anything else like influenza. There are some patterns that you can look for, but generally speaking, most people wouldn't be able to distinguish those things. You can only really distinguish by someone who's quite experienced and knowledgeable and probably a healthcare provider. But the things that I advise my patients and people that I work with to look out for in the community are severe symptoms. So people who have unremitting fevers, people who are developing shortness of breath, where they can't, do the things that they normally do without getting short of breath, or even worse, where they can't get out of bed, or they're feeling feeling so unwell that, they can no longer carry on with normal activities that they're familiar with, that they kind of do on a daily basis. Those are the kinds of signs and symptoms that something's wrong, that you need to go get attention either from your doctor or from somebody else, God forbid a hospital. But in short answer to your question, there really isn't any way to distinguish influenza from coronavirus 19 from one of these other more typical respiratory viruses. What I can say is that as of the present moment today, it's much more likely for you to be infected with influenza or another respiratory virus than it is for you to be infected with COVID.
I want to give other people opportunities, but I can ask you now, this is a little bit of a rhetorical question, so I apologize in advance. Because I think you did mention to stay away from live animals. Now, I have 4 pets, so my next question is, okay, stay away from live animals. Is that something to be concerned too? I mean, I know we don't have that to worry about right now here, but is that something to be concerned maybe in the future with your pets? I don't know. Did I just throw something at you and answer? I don't know.
Yeah, sure. Actually, we did get an update. If you look at my portfolio, it's because it's rapidly developing. My portfolio is also rapidly expanding. So we did get an update about pets. I mean, there was one case in China where a domestic pet, I believe it was a dog, came up positive for COVID. Now, they don't know whether that was something that the dog may have been exposed to from their owner. However, what they're recommending is that if anybody, unfortunately, comes down with COVID, they're going to be taking the respiratory precautions. They'll be wearing the masks so they do not spread the droplets. Not only to their family members, but also to their pets, because right now there isn't enough information about transmission between animals to humans. It's again a novel situation, but there was something that was just recently reported in the past 24 hours.
I have a question. On your slides, talking about community spread, we've now found out that it's spreading through the community without necessarily any travel. With that in mind, it also says they start to get more of the test kits in. I'm hearing on TV that they're going to do more widespread testing, not just people they think so. Do you have any idea how they're going to do that in terms of, they're testing hundreds of thousands of people daily, so it's not everybody that just comes down saying I'm sick. So is that going to start in this country? If so, how are they going to pick the people? How are they going to walk into this room and select people and say we should test you?
Well, right now, I don't think they have the resources to test the general public. I think specifically they would test those patients who were hospitalized and who it seems like they might have the influenza. Influenza comes back negative. They try and rule in or rule out all the other possible diagnoses, and those have been ruled out. And those patients, they would who have a high suspicion, or we don't know what kind of respiratory infection they have. Those people might be tested, but a general test for all individuals in the community, I doubt that would be feasible. Dr. Kessler could.
So, as you rightly point out, the CDC has developed criteria whereby testing would be done on a patient who presents with some kind of sign or symptom. And these criteria are being updated on a regular basis. So what we were doing 4 weeks ago is not what we're doing today. And I imagine that as things change and evolve in this country, the criteria are going to change along with that situation. So, I think that I've been on many a phone call and conversation with other healthcare workers and providers in our state and beyond our state, and we are also very concerned about the ability to do rapid testing, and we are making our voices heard both at the state level and the national level, to ensure that we can do what we think is clinically necessary. As of today, we're still meeting with challenges as far as testing is concerned, but I think with the ongoing evolving situation and with a strong support of our healthcare workforce in New Jersey, I think we're going to see the changes that we need and the materials and resources that we need to take care of our communities in the very near future.
Other questions? Not here, not here? Yeah, here.
Actually,
Did you,
I just wanted to add something about the criteria for evaluation and what would be considered a person under investigation. As the doctor indicated, these are individuals right now at the moment that are ill, fever, severe respiratory conditions, but they did expand. Anyone with a fever, severe acute lower respiratory illness with no source of exposure. So this is something that they will be, accept, and this just came in today. The criteria changes every day. And so yes, Community Florida, there is going to be expanded testing.
The one addition I'd like to make to that, so as is pointed out, the criteria for testing or the recommendations for testing are changing and evolving along with the situation on the ground, both here and other parts of the country. But I think the message needs to be sent clearly to our communities and our public that they should not be rushing to the emergency room. They should not be rushing to their doctor's office requesting testing, because right now we don't have the capacity to perform that testing in most mildly symptomatic or asymptomatic individuals. So I know that we've had many, let's say, more than a handful of folks come to our facility looking for testing, and unfortunately it turns into a very difficult situation for them. They're looking for answers, and we're trying to provide answers as best we can, but generally speaking, we're not testing minimally or mildly symptomatic people at this time. So if people have a very mild illness or don't have any illness at all and not feeling well, but just concerned, know that as of right now, we're not doing broad community-based testing for this virus. Really, the testing has been focused on those people who have fairly significant symptoms and are fairly ill, sometimes ill enough to be hospitalized. That may change, like I said, based on the evolution of how things progress over the next several days, weeks, and months.
Hello, how are you? So, as a mother of a type 1 with, so that's an autoimmune disease, so he has a low immune disease, I reached out to his pediatric endocrinologist, and much to what you said, he said, don't rush in, we don't have this solution. But I think that I'm trying to educate him and my other children as to how serious this is. This isn't a joke. So I guess my question is, I'm around kids all day, and literally what they do is they, no corona, no corona. They're taking it as a joke. So I'm feeling that we need to get into not only the community, but also to the children, the educators, and take it to the level that, yes, it's hand washing. And like the Assemblywoman said, we have to do in between the fingers. We have to get out there to the point where a teacher sent out a reminder that if you send in disinfectant wipes, your kid's getting 10 extra points. So I guess you just answered my question with when is it that we go in to make sure when we are low on our immune system. I'm lucky, not like Suzette, where I think I'm around so many kids and they have so many germs. I have a high immune system, but for our low immune system people, what are the best strategies and education? Sorry, that's a one question.
Well, I think we have an understanding that people who have immune issues, their immune systems are weakened either by diseases they may have, such as HIV, or the medications that they're on. Many of our community members are on medications that suppress their immune systems. Or they may have other medical problems that cause an impairment in their immune system, like severe diabetes, for instance, or like I said, HIV. I think these people are at increased susceptibility to illness, including the novel coronavirus, as well as other respiratory infections. And those individuals need to take even more precaution about the manner in which they, live and work in their communities and in their homes. And I think the preventive advice that we've been sharing with you and what you've read in the newspapers or seen on TV, I think still applies. It just applies even more so to those individuals. And those individuals rely on us more than ever. And I think this hinges on something that was brought up in the excellent slide presentation, which is, yes, we need to be aware of the novel coronavirus and we need to be concerned about it, but we need to recognize the fact that influenza and other viruses like it are much more common here. And we already have a tool in our toolbox that we know can help prevent the spread of that virus, which is, in addition to what we already discussed, but we have an effective vaccine for that virus. And we anticipate someday, in the not too distant future, that we'll have an effective vaccine for novel coronavirus or COVID-19. But that's not something that we're going to have in the near horizon. I think that the estimates from the NIH have said probably in the 12 to 18 month range. So this is not something that we're going to have to fall back on in the very near future. So again, the similar preventive measures that we've been discussing are even more important for those folks who have issues and are more susceptible potentially to this virus as well as others.
Hi, my question is, we know there's people in the hospital right now, and there's been people in the hospital right now. How have they been discharged in terms of what medications or other solutions medically speaking allowed them to get out and resume their normal lives? Does it make sense? You know what I'm saying?
In terms of patients who were suspected of having
That probably had it.
or that
That had the virus and then recovered in the hospital. Well, what was their secret to recovery? In terms of medication or other solutions?
So again, we're learning more and more each day about the natural history, meaning how the disease progresses over time in an infected individual. Again, to reiterate, no confirmed cases in New Jersey, no hospitalized patients currently that have been diagnosed with COVID-19. We have 100 or so cases across the country. Not all 100 of them are in the hospital. Many of them, in fact, the majority of them are only mildly ill. They have what would be considered by most people to be a common cold, except that they had travel history that made them concerned about the issue and potentially needed to be tested. Many of them, about half of that group, maybe slightly under half, were people that were brought back by the government because they were on the Diamond Princess. So if you remember last week or 2 weeks ago, the Diamond Princess was this cruise ship that was stranded in Japan after there was an outbreak of novel coronavirus. There were about 40 Americans on that ship diagnosed with novel coronavirus. And those individuals have been repatriated and are now, some of them are in the hospital, some of them are at home, being managed at home. But we know that about 80%, 8 in 10 people who come down with this virus will have minimal or mild symptoms at most, meaning they may have a mild cough, they may have a little bit of a runny nose, they may have a mild fever. They're not winding up in the hospital. They're not winding up on life support. They're not, requiring any special therapies or treatments other than what they would normally get or use if they had a common cold, like taking Tylenol regularly, staying well hydrated, things of that nature. So I think that the folks in our country who have these 100 people or so, many of whom are slowly improving, but some of whom have not improved, and we've already had 6 people that I'm aware of as of late this afternoon who died of novel coronavirus. So it does affect more severely a small group of people, but like I said, most people will recover normally after a period of time with just very simple conservative measures like we've been discussing. Just symptomatic therapies, Tylenol, and well hydrated, keeping yourself well hydrated, and so on and so forth. Folks that are more severely ill, they have been requiring, sometimes very intensive care in specialized hospitals. Sometimes they've been requiring life support, but these are a very small percentage of people who are infected with this virus. But that's why it's important to keep an eye, and that's why it's important to remain concerned about this, because if it spreads more widely, there can be more people that have severe infection, even though the vast majority of folks will only have very mild disease or minimally symptomatic disease.
In following the information from basically media, initially it talked about the use of masks and things were not required. Then I began to hear about if masks were to be used, using a respirator as opposed to a mask, and there was a difference between the two. And in the slide you pointed out an N95 respirator, just like when you use with spray paint or something. Are those guidelines changing now, with the possibility of using a respirator and not using a mask, or has any of this changed at all?
Mr. Roth, the guidelines have remained the same in terms of using the N95. Again, that's a mask that's able to filter out the virus. They do recommend the other powered air respirators, one that mechanically pushes air into the face piece. For individuals that may have respiratory issues, breathing issues and things, but for the most part, the personal protective equipment in terms of masks has remained the same.
Just a general mask would still be usable?
Oh, no,
as opposed to a respirator?
It would be an N95 or a respirator that's able to filter out the virus.
Yeah, but I think that the point, if I'm interpreting your question correctly, correct me if I'm not interpreting correctly, is that the N95, the respirator, these are specialized, this is a specialized piece of equipment. It's primarily used by healthcare workers for protecting themselves and protecting the patients that they're caring for. It is not recommended, as far as I have seen on the CDC's information and the State Department's information, that the general public needs to protect themselves by wearing N95 respirators or other forms of respirators to protect themselves from this virus. I think the message to the general public is masks should be used, the surgical masks can be used if you are sick, to mask yourself to prevent the spread of droplets, infectious droplets from you to others, your family, your loved ones, your co-workers, your friends, your neighbors. So I do not believe that the CDC nor the State Health Department is recommending the public go out and purchase N95 respirators. But you may see, should things change, should you visit a hospital where there are patients who are being cared for and who have been diagnosed with COVID-19, you may see healthcare workers wearing these devices. And the reason is because we need to protect ourselves so that we can provide the care and support for patients that are coming into our facilities and prevent its spread amongst the other patients who may not be infected in our facility. Does that sort of address your question?
It does. Thank you.
Hi, I'm over here. Good evening. With regards to the test kits, how reliable are they? How reliable are the testing kits that they have? Because I heard a media report that someone was tested and they released her. I guess maybe she was in quarantine or something like that, and they released her, and then the test came back positive, but she was already gone.
I think I read the same article. I don't believe it was a matter of the accuracy of the test kit. What happened was they didn't have all the test results in, and they released this individual, and then the test result came in. So it wasn't a matter of the test accuracy. It was a matter of getting the reports, and that was just an oversight. I guess wherever the facility wasn't. But I do remember reading that.
So the test kits are pretty accurate, because based on what I'm hearing is that the symptoms are, they mimic just a regular cold, they mimic the flu, and an individual can perhaps treat themselves, maybe even get better. And when is that line crossed? Like, when would you know you even had COVID-19 if you've gotten better? And would you go for, you understand what I'm trying to say? Like, when do you test people? When you're severely ill, then they go get a test?
Yeah, I think this is a point that it can be quite difficult to comprehend. But the way that it's working as of right now, and again, this may change in the next day, 2 days, 5 days, a week, 2 weeks. But what's going on right now is that folks who are not severely ill, we're going to do the same thing for those folks if they have COVID-19 or if they have the common cold. The management, what we as healthcare providers, what we as public health officials recommend will be the same, essentially, which is stay at home if you're sick, don't go to work, don't infect other people, treat yourself symptomatically with fever medications and anti-pain medications, keep yourself well hydrated, try to keep yourself, keep your nutrition status up, make sure that you have enough supply of your food, water, and other medications. That would be the same advice whether or not you had mild COVID-19 infection, whether or not you had mild influenza infection, whether or not you had the mild common cold. I think the difference is, again, what I was trying to explain earlier is, what are the warning signs, the symptoms, the issues that one may experience that would tell them something's wrong and I need further evaluation. I need to see a doctor or I need to see a health professional to make sure that I don't get worse or that I may need additional treatment to what I just said. And again, I think that the signs are sort of what I laid out before. So most importantly, trouble breathing. If you or another person or a loved one or family member is having trouble breathing when normally they're well and healthy and active, that's a very severe and worrisome sign. Now, you're talking about a loved one. Many of the patients that I deal with on a daily basis who have very severe lung disease, they have emphysema, they're on oxygen, they may have trouble breathing right from the base, every day of the week. But you're talking about somebody who's otherwise healthy, working, or out in the community and active, and then all of a sudden developing severe shortness of breath. I mean, that's a pretty severe warning sign, and that's the kind of thing that we're talking about. Severe fevers or fevers that are unremitting after 48 or 72 hours of conservative treatment. People who are so unwell they can't get out of bed anymore. People who are so unwell that they don't know who they are anymore or are confused. People who have a severe cough that may be causing distress or maybe making it challenging to breathe. These are the signs and symptoms of a warning that something's wrong with our bodies and we need to seek medical attention because maybe there might be something else that needs to be done. And a part of that may be, if appropriate, to test them for COVID-19, or to test them for influenza, or to test them for any other number of things that may be causing that issue. Is that
Yes, severity.
Yeah, I think it comes down at this point to a matter of severity. Now again, this may change. I think what I say today will probably be, I'll look back on it in a week or two and I'll be like, why did I say that? But we have to go on the best information we have today because we know this situation is rapidly changing. 3 weeks ago, we had 4 weeks ago, we had under 1,000 cases proven across the world. We have close to 100,000 cases today. We had no cases in the United States, and we have 100 cases today. So this is going to change. The recommendations are going to change. What I'm saying now will probably be outdated in 48 or 72 hours, hopefully not, but possibly. But I think for the public, it's important to recognize if you're not feeling well and something feels wrong, you should, contact somebody and seek advice and attention. I think there's many outlets for that, but we do have to be cautious about how that's done. And I think again, there are resources available. So there's the public hotline, which all of us pointed out, the New Jersey Public Hotline, which is available 24/7. You always have the option of calling your primary care provider. You always have the option of calling your local emergency department to get some assistance if need be. Again, I caution, and we've been cautioning in our community against people just showing up to the emergency department if they have reason to believe they're infected with this virus, because of the measures that need to be taken to protect other patients and staff at the hospital.
Several questions. One, is there anything that would suggest that if you've had the flu shot, that it could help lessen the symptoms or the severity if you are infected with the coronavirus? And do we know anything as of yet, if somebody's been infected with it, what their chances are of becoming reinfected once they go back out into the community if they encounter that situation again? Or is that just too early to tell? And also wanted to ask about when you mentioned about the hospitals that were prepared and that type of thing. If we were to have a massive outbreak in any given area, are the hospitals in this area prepared to treat people, a large volume of people that may come in respiratory distress?
Well, regarding the first question, patients who have received the influenza vaccine, that's a complete, influenza and coronavirus, as you mentioned, are completely different families of viruses. Patients who get the influenza vaccine, we have no knowledge that it would prevent a coronavirus, or it doesn't have any relation to the coronavirus. It will prevent the influenza. That's what it's a vaccine for. So
But it won't
we do
make
not.
it any less severe either. Then, you figure if you're protected against one thing,
Then it might actually help you fight something else.
Right now, we don't have any knowledge of that.
I think the answer to your question is we don't know for sure. I don't think that we have any scientific reason to think that would be the case, but certainly it may be possible. What I can say, as a corollary to your question, is we do know a lot about the influenza vaccine's effects on influenza disease, which again is much more common at this point than COVID-19. And I think it is a point to reiterate that it's never too late to get the influenza vaccine, because influenza can affect individuals quite severely. I had influenza even despite the fact that I had the vaccine, and I was in bed for 4 days. So that points out two things. One, the influenza vaccine is never 100% effective in preventing influenza, but it has other secondary effects, some of which are getting to your sort of point of your question. Some of the secondary effects that have been demonstrated in several studies are that it decreases the severity of the illness if you should get it, even if it's not fully protected from you getting it. It can reduce the likelihood that you are hospitalized because of the infection. And it can reduce the need for adjunctive or secondary treatments, such as the need for antibiotics for pneumonia. So there are other reasons beyond just preventing influenza that the vaccine is useful for. We don't think that it has much of an impact on the incidence or severity of a novel coronavirus infection, but certainly it can help protect or at least minimize the impact of influenza infection, which is, like I said, and we've all said, more common and affects more people at this point across our country and across the world than novel coronavirus has. And you
Again,
had
as far as,
follow.
right, as far as being reinfected with it, if
Yes.
somebody comes down with it, they recover from it, now all of a sudden, there's a flare up in another area, is that something that they have to be concerned with, or it's too,
I think
it's too new to
it's too
tell?
soon to know the answer to that question. I think it's too soon to know. We don't know if people can get reinfected with COVID-19, and I think there'll be a lot more information forthcoming as time goes on, as we learn more about this outbreak to answer that question. And then finally, I think your third question was in response to hospital preparedness, and that's something that I'm involved with on a daily basis over the last several weeks. I think hospitals across New Jersey and probably across the country are working every day to prepare ourselves for managing, dealing with, and addressing the issues related to COVID-19. You know, I can say with personal experience, our hospital is ready and able and prepared to deal with a sporadic spread of this virus. If the situation changes to where there's widespread community transmission in our area or other areas, I assume all hospitals will be acting in simultaneous to ours, and the response will be robust, and the response will be coordinated both with other facilities in our area as well as with the New Jersey Department of Health, with the support of the CDC as well. So I think we will have time. This is not going to be something where today we see 0 cases and tomorrow we have 5,000 cases. This is going to be a sort of slow-moving train that we're going to have some advanced warning on. So we will have time to ramp up and stand up our preparedness. Right now, I think we're prepared for what we expect to see currently. The situation, again, is evolving. I think over time, that may change. And the level of our preparedness and exactly what we're doing to prepare may be changing. Is there any?
Good evening, doctors.
Hang on a second, I'm sorry, I apologize.
Oh, okay.
If I could just make a comment, my name is Mary McTeague. I'm one of the vice presidents at Trinitas Regional Medical Center in Elizabeth. I am also the chief nursing officer, so I do have a very significant healthcare background. And certainly, I just want to say that the things all the things that the speakers have said, and in terms of Dr. Kessler saying about readiness, is that we train for these types of things. Not only are we doing ongoing surveillance of what kind of issues there are in our community, but over the years, because of our proximity to Newark Airport, to the Turnpike, and to communities that have high risk types of activities that occur in them, we train for what we call surge. And that means large numbers of people coming into our hospital potentially, and what we do with the patients we have in the hospital, and how we coordinate with local and state agencies in order to be able to provide appropriate care to all of the people that will potentially present for care. So I just wanted to say that while I'm not in the same system as Dr. Kessler, that certainly we also are ready for patients if need be.
Good evening, doctors, and thank you for your time this evening. Maybe you heard the news breakthrough news today that 4 schools were closed in White Plains and Westchester. One, a father was very, very ill with the virus, and he's a Presbyterian, but the turnaround was very quick. They closed 4 schools because 2 of their sons are in the school. So I'm wondering, and maybe the mayors and the council people know this answer maybe better than the doctors. What is going to be the procedure when someone in our community, an adult, comes down and their children are in the public school? I have 30 years experience running a daycare with 100 children under the age of 7, and I also taught early childhood, and I know how the parents are, and they do not want to hear a school is going to close. But I think we're eventually, when the situation occurs, I'd like to know the steps that will be taken. And also I wanted to thank you for informing us that the swabs are available, because we've been hearing so much negativity again, with politics and all the other situations on the news. So that was really good news tonight, so I'm glad I came. We're very interested in how the schools will be closed, when and if that becomes necessary. Thank you.
Okay, I'm gonna take a stab at this one, because I did send out some guidance documents today, updated guidance documents to our superintendents. If we had a few isolated cases of COVID, I mean, those children would be treated, would go see their physicians, would eventually be released after a plan, and they would not return until they were fever-free for at least 24 hours, if I'm correct on that. I know on a mass level, if there's a certain percentage of students that are out, the Board of Ed is working towards contingency plans to keep their education, or the providing of education, consistent and for the duration that they would have to close the schools. I don't see that. Hopefully, we did discuss on our conference call this afternoon that particular situation and the general feel from our State Department of Health that closure may have been premature. So, I know that our Board of Ed is working on double checking their contingency plans for continuity of operations, but from a clinical standpoint, I mean, the children would be excluded until they were.
Just want to reemphasize that call today was for government leaders, along with healthcare professionals and folks like Marconi, to emphasize the fact that there'll be coordination with the state. Dr. Cristelli led that call, right, our health commissioner, and you can be sure, at least I felt a comfort level, feel free to express differently, that there will be extensive coordination where you see those kinds of cases. You won't see you'll see a coordination with the Department of Education to make sure that folks are there, not only on the local level, but on the county and state level as well.
I have two questions. I have a daughter that's a teacher, and some of the students are being ostracized that have Chinese background. Kids are also talking about not eating Chinese food. That's number one. Number two, any containers that were on the water coming from China, are they being stopped?
So, as far as stigma is concerned, I don't know that there was a specific question about it, but I think
Is
it's...
anything on the CDC site to educate teachers in how to talk to the students if they see this?
Gotcha. There actually is. I mean, I saw it this morning or this afternoon on the New Jersey State Department of Health website as to how to combat stigma. It's an unfortunate side effect of the concern, sometimes bordering on panic, that's pervading our communities at the present time. So there are some resources available. Again, I saw it on the New Jersey Department of Health website. I'm not sure if it's NJDOH derived material or it's federal derived material, but there are resources available that I've seen. And as far as quarantining of products coming in from China, it's very unlikely that any of those products would be contaminated or harboring the coronavirus, given the length of time that it's taking for those packages or products to make their way into the United States. So as far as I'm aware, there's not a quarantine or an embargo or testing of any of the products or packages that are coming into our country.
Because I know I work for a grocery retailer, and a lot of questions are coming into our consumer affairs from customers in regards to food.
Well, in terms of the safety and the quality of our food sources, we work very closely with the USDA and our federal partners. They have their regional staff here, and we are in contact with. They actually have some individuals at the State Department of Health that were former FDA, USDA staff. So we are constantly getting updates on product information. And, you know, at this moment, at this time, we don't know of any embargoed products because of the virus.
A couple more, I think. I'm sorry, do you have a comment? I think a couple more and then we'll kind of move.
Hi, excuse me. I'm happy to hear you talk about allaying the fears of people. It seems to me like the whole discussion doesn't talk enough about the preventing of illness. You know, there's studies showing that you can prevent cancer, you know, with nutrition, exercise. Women that walk 9 minutes a day have half the heart disease. 9-minute walk, half the heart disease. I think, you know, people should be talking about the concept that we can affect this situation. And so I'm happy to hear you guys. It's not really a question. I guess the question would be, why don't we talk about this more, the concept of prevention?
I think we could spend probably a week discussing that question. When it comes to healthcare, prevention is not something that has been strongly emphasized in our healthcare system, unfortunately, and I think it's a detriment to the overall well-being of our communities. But I do think we are working, and I think the message is being delivered in the context of this particular issue, that there are a lot of things that we can do. They may not sound very sexy, they're not like a new drug or a new vaccine or a new medical device, but they are very well-established, well-researched, and well-evidenced measures that we can take, each one of us, to help prevent the spread of this virus in our communities and in our households. And I think that message is getting out. And it's surprising to me even now, despite the fact that we've had some of the worst flu seasons on record in the last 5 years, that this message is still being met with, you know, a degree of surprise by many members of my community, and I'm sure others communities as well. So I think that message of prevention needs to be continually strengthened, needs to be continually reiterated. And I think over time, people will start to get the sense that they can affect change and affect the health of their own households, their communities, and the larger country as a whole. But yes, I 100% agree with you that we need to be focused on what we can do, each and every one of us, to keep this at bay.
Can I give a shameless preventional plug for blood pressure checks right over here, information and cure and all the rest, so please stop by there as well.
Many of the ingredients for basic medications are manufactured in China. Do you see any shortages popping up?
I was aware of one shortage that was probably related to issues with the supply chain in China of late. I think what we are seeing in China in the last week and a half, is that we do see an abating of the number of new cases that are reported each day. I think that is a positive sign. I think that the outbreak there is stabilized. Maybe not resolved. I don't expect it to resolve over the next several weeks. It may be into the middle of the year or into the late part of the year. But the supply chain is threatened, both for medications as well as other devices and materials that we use on a daily basis in healthcare. Fortunately, there haven't been critical shortages as of yet. We hope that the supply chain will remain in place. And there are people working on ensuring that that is the case. But again, we can't predict what's going to happen across other parts of the globe and in our own backyard. So we do need to keep a very watchful eye on that. But I do think that we will slowly see an abatement of what's going on in China, and the supply chain should be starting to loosen up over an extended period of time, in the next 6 to 12 weeks probably. What's going on there, based on what we've seen in the last week and a half.
You may or may not have the answer to this question, and it really relates to those who have already died from the disease. Were there any commonalities amongst those patients? Did they have any prior health histories that were common? In addition to, we hear a lot about runny noses and high fevers and that sort of thing, but for those who actually died as a result of the disease, were there commonalities?
We don't have a very clear way of defining those folks who are at the most highest risk of severe disease or severe outcome of a disease like this, such as death, unfortunately. But what we do know is that the vast majority of folks who have died of this disease have had underlying comorbid medical conditions, whether that be severe heart disease, severe lung disease, cancer, or other issues. In addition, about, I think, greater than 95% of all mortalities from COVID-19 across the world have been over the age of 50. So the people who are most at risk probably are older populations who have a number of chronic medical conditions. Now, that's not to say that younger folks who are otherwise healthy can't have severe outcomes. And in fact, I think that there were at least 2 Chinese doctors who were under the age of 40 who succumbed to this disease. We don't know all the clinical details of their condition. Maybe they did have some underlying problems that we aren't aware of. But it can affect, in rare cases, young people severely. I'm unaware of any pediatric deaths. I'm not aware of a pediatric death. There may have been one, I think. But it appears that the people at greatest risk are those on the older end of the spectrum. 50 can be considered old, which my definition of what is old is changing day by day. But it appears that if you have chronic comorbid conditions that are out of control or uncontrolled, you certainly are potentially at higher risk. That doesn't mean you're definitely going to die, but you're certainly at risk of more severe outcomes than somebody who's younger and otherwise.
Okay, I think that'll close out our questions at this point. Joe? Go ahead.
Are there any myths, disinformation, or misleading claims that the public should be aware of or cautious of?
Well, I don't know if it's a myth. I think there is a certain degree of panic in the community, and not that people shouldn't be concerned. I think people should be concerned. It's a very serious public health threat that we're dealing with. But we need to remember that most people, the vast majority of people, survive with this infection. And in fact, most people have minimal, if any, symptoms. They may not be any more sick than what they would have experienced if they had the common cold or mild case of influenza. So while we do need to take all the precautions that we've spoken about, all the coordination that is already ongoing amongst the local, state, federal health organizations and infrastructure should continue. I do think we do need to, be aware that for the most part, most people will be okay. We do need to take care of those who are our most vulnerable members of our community. So I would say that's probably the biggest myth, that there's really no reason for panic. There's reason for preparedness, there's reason for planning, but there's no reason for panicking and thinking the world is going to come to an end, or our society or civilization is severely threatened. I think this is a public health threat that needs to be taken seriously and is being taken seriously. And we all just need to practice the appropriate degree of caution and put in place measures that we can do on a daily basis to help prevent this from getting worse. I don't know if you guys wanted to address that.
Sounds like a great way to close. I'd like you to join me, Annette and I want to begin by thanking Dr. Kessler, Dr. Sangiel, and our health officer, Marconi Gasper.
Some of you are crying. First, I'd like to, because when he first mentioned this, I'm like, really? Now? And this was a while ago. But what timing? Just think about it. You just turn on the TV and some of you are crying. First, I'd like to, because when he first mentioned this, I'm like, really? Now? And this was a while ago. But what timing? Just think about it. You just turn on the TV and